build on something you said this morning. It would be a rare situation where the EHR in and of itself drives the kind of innovation you spoke about this morning, either new business model or new service delivery, right?
Right.
So if we think about really innovative practices, and you were just mentioning one in Seattle, they're thinking about things like becoming a patient-centered medical home. Well, an EHR gets you started, but you need collaboration technologies to do that. You need to be able to consult with your patients and their families more frequently than the typical come to the office in-person visit, right?
Right.
And in that model, you're actually managing a care team. And they may not be all physically located inside your practice, and that care team's going to be different for different patients, right? So there may be a dietitian involved, or there may be physician specialists involved, there may be a nurse care manager from a health plan involved. And so it's both the data from clinical systems like EHRs, as well as the ability to do the people-to-people interactions, collaboration, communication as well. You might want to mention the Seattle practice you were just
that'd be
sharing
helpful.
with us.
Sure. Well, I think there's a small practice called Q Alliance in Seattle, and basically they've developed a prepaid primary care practice, and it was a very strong implementation of the medical home concept, collaborative team of practitioners, and they have to do that because of the prepaid model. They need to be able to offer the capacity to give their patients a high number of touch points should they want it. But the difference is those touch points they've decided can be phone calls, emails, on top of the regular physician visits. And they can include nurse visits and interactions with all of their staff. They have their own pharmacy, their own lab, and so all of these are points of potential intervention and engagement with patients that today are completely separated and considered not part of the delivery system, at least patient-physician interaction.
So that's going towards what you've discussed in the book, the more the cooperative model, the networking, being able to bring everybody together through other means. Are they using social networking in some ways here, or is it all through a particular process that they have or a system they have?
I mean, it's quite simple. I mean, it's certainly nothing like social networking the way we think of Facebook. The implementations I've seen basically, at their heart, offer the same data, the ability to view the same amount of information to any practitioner. So I guess the right term might be user agnostic, that it doesn't matter if you're the nurse or the doctor, you see the same screens of information, and therefore either party is able to answer questions on the phone. And so at Group Health Cooperative, also in Seattle, they like to brag that their physicians are able to answer the phone and answer questions, but their nurses can do the same. And the patients are simply relieved not to have to go through a chain of command in order to reach somebody who can actually answer questions. So a collaborative system is one that provides the same information to all parties. And I would also encourage these types of systems to offer that data for patients to both view as well as enter data.
So the patients could actually put information into their own files.
Yes. So I think we haven't quite reached that point yet, but it's only a matter of time because again, there's a lot of data that is that exists outside of the confines of the healthcare system that is going unrecognized. So that includes, groceries and nutrition, exercise routines, trips to, fitness centers and spas, to the GNC. All of these types of health-related data, simply because the physician and the traditional healthcare system believes they're outside of their bounds, does not get incorporated into the health record. Eventually it will, and I think it's going to be driven by patient entry as well as the tools that enable that entry to happen.